professional instead of waiting this out to see if we could get some relief. Very, very happy to say that the consultation went extremely well. So here's a little bit of that.
So this is a model of the shoulder, right shoulder joint. It's as if you're looking from the front. This is the collarbone and the shoulder blade bone. This is the arm bone which moves in the socket. So basically this is the shoulder joint, and this joint on the top here, this is the AC joint. The shoulder is protected by muscles. Like these muscles, these are rotator cuff muscles. There are 4 rotator cuff muscles, one in the front, one in the back, 2 in the back, and 1 on the top. So these muscles, they brace the joint and they push it down so that it can remain in the socket. Sometimes what happens, there will be some friction between the top bone, which is called acromion, and the bottom bone. The space becomes narrow, and that causes these rotator cuff muscles to degenerate, cause some tear in that area, or there can be some inflammation. So all these things can give rise to pain. If the patient comes initially in the early phase, then there will only be inflammation in this area, and we can prevent it from going to the rotator cuff tear stage.
Right.
So what you have is, when I examine, I see that you have inflammation in this area in the front here. That's why when you lift your arm and bring it across like this, there is pain in this area. And when you point, you also point towards this area here.
Yes.
So it is not entirely related to the rotator cuff, but there is bursa under the acromion. So there is some inflammation of the bursa. Possibly there is some amount of impingement, like when you bring it to the front, probably this is digging into the tissues here. So what we'll do now is we'll do an X-ray just to know the alignment of the bones. We will not be able to see all these muscles and tendons, all those things, but we will get a rough idea about the bones. And based on the alignment of the bone, then we can take a call. Because the duration is very short, we will not be doing any extensive investigation at this point. But however, if you had come with a history of 3 months, I would have told you you need an X-ray and also an MRI scan.
Right.
Because it's a short duration, we'll just do an X-ray and then take it from there.
Okay. Sounds very good. And what's normally, I mean, I guess it'll depend on what the X-ray says, but what's normally the treatment option?
So if the anatomy is normal,
Yes.
and because you have short duration, we will start with simple things like anti-inflammatory,
Right.
simple measures like avoiding activities, rest,
Yeah.
eyes therapy, or maybe physical therapy. With that, most of the times they settle down.
Okay.
But sometimes, like if I treat like that for 10 patients, maybe
Yes.
1 or 2 may not settle down with that. In that case, we may give an injection to reduce the inflammation, or we may ask the patient to go for an MRI scan,
Right.
and then we take it from there.
Further exploring. Okay. All right. Sounds good.
So this is the front view, the way we see the shoulder like this. So that's the front view of the shoulder.
Yes.
And let's see what it says. I want this angle to be somewhere around 35 degrees.
Uh-huh. Can I zoom in on my own X-ray? That's
Sure.
okay.
Yeah. So it's exactly 35 degrees. So
Ah.
we're happy with this angle. So
Yes.
we don't have any issue in this view.
Okay.
And let's see the space here. Even this space is around 1 centimeter, which should be around 1 centimeter. I'm okay with this space too.
Okay. So it's a little bit shorter than 1, but that's okay.
That's fine. Yeah. Somewhere in that ball,
Yeah.
and that's fine. So let's see the side view.
Yes.
Yeah, here is the issue.
Uh-huh.
Let me zoom it in and move it down. So you're looking at the shoulder. Let me do it. Let me flip it. Okay. So you're looking like this. This is the acromion, this top portion. The shoulder ball is here. And normally this acromion has to be flat. If you see like this, it'll be like a flat piece of bone. In your case, what is happening is it is curved down like this. There's a beak which is digging into the front portion. So when you move your arm to the front, This irritates the tendon and causes the pain.
Okay.
To show you, see, this is a normal acromion, like this, flat, and then comes the curved, and then comes the hooked with the beak in the front. And your X-ray looks like somewhere between the curved and the hooked type.
Oh, wow. Okay.
So that is the reason why you have pain in that particular spot in the front. So your symptoms, the findings, what I saw, and this, they're all matching.
Yeah.
So there's no confusion in the diagnosis. The treatment is going to be straightforward for this.
Okay.
Because
now, why would that not be flat like you would have expected it to be?
Some developmental changes. We don't know why it happens. So sometimes we grow like that.
Yeah.
So
is that something that it could have been like that my entire life?
Yes. Yes. So it is not the bone alone which will give the symptoms. As it may be, in addition to the shape of the bone, there may be posture, like the way you slept. Maybe you might have slept like this. We don't know. Or you might have lifted something. So all those things will contribute.
Right.
And sometimes lack of muscle strength can also make the bone to move up and cause irritation.
Right. So I know, for example, I have scoliosis.
Yes. Yes.
So that may be impacting.
Unlikely.
Unlikely?
Okay. Yeah. Because this looks more localized. And scoliosis usually causes some issues in the back, because the muscles will go from the spine to the shoulder blade bone and then affects the shoulder. Yeah, I'm not saying that it will not affect, but this condition unlikely.
Yeah.
Yeah.
Okay.
So what we'll do is, see, we cannot fix this with medications or injection.
Right.
Okay. At the same time, you don't need a surgery to fix it. So we will start with anti-inflammatory. If the inflammation in this area, if it gets better, there may be some effective space there, and then that can reduce the pain.
Right.
If you don't respond to these anti-inflammatory medications, and we give some more time and then see how it goes. If not, then we do an MRI scan and then take it from there.
Okay.
Okay.
All right. Sounds simple. Okay. Thank you.
All right. You're welcome.
All right. So just by way of a follow-up, we did the anti-inflammatory medication, which was prescribed for 10 days, about halfway through that medication as we speak. By that first evening, after taking the first pill, I can tell you that there was a significant reduction in the pain, so much so that for the first time in several nights, was able to sleep peacefully and get a good night's rest, and just going to continue with the medication and see how it goes from there. So physical therapy might be next, might be some strengthening exercises involved with the shoulder and the arm region, which is really, really important to, strengthen these areas to give them the support that they need. So we'll see if physical therapy is required, and pretty much just take it from there. It'll be a bit of a watch and see situation, but wow, once you get the pain under control, you just feel so much better, and you're able to live your life a little bit more fuller, that's for sure.